So patients that receive certain chemotherapeutic agents that can commonly cause numbness and tingling in your fingers and toes. Not all bladder cancer patients will receive these chemotherapies. And then we look at, well, what can we do to improve that? It's a shocking symptom for some people. It is often transient. We know that we recommend exercise. We look at therapies that can improve, that can change the blood flow and improve the symptoms themselves. So some people will wear ice gloves during their treatment, and other people, depending on their treatment, will actually receive acupuncture or reflexology, which is like acupressure on hands and feet. And we're actually running a study to look at, does it improve long-term outcomes, and does it reduce the severity of the peripheral neuropathy? So when you're looking at symptoms, we're saying, well, there's evidence to inform the safe use of acupuncture for peripheral neuropathy, but we want to know, does it actually change the outcome? And that requires randomised controlled trials using placebo, and that's really our focus, is pushing the boundaries and saying it's safe. How effective is it? Is it more effective than something else? The suggestion is that yes. We also look at, what about vitamin B12, for example? So we know that vitamin B12 is really essential for nerve healing, for mood, for your energy levels, and people who have had either surgeries that include their bowel or on a vegetarian diet or have an inadequate diet may actually be lacking in B12. And so if your B12 level is low, you may be at higher risk of developing quite severe neuropathy. So actually measuring B12 and correcting it, similarly with iron, measuring it and correcting it, and other micronutrients like vitamin D are all really essential in our body's healing and ability to have reduced severity of some symptoms that are commonly related to chemotherapy. Another symptom that a lot of people experience is fatigue, and we say, well, what's the evidence to support how we manage fatigue with the use of an integrative approach? So we look at the national cancer guidelines that have developed, the NCCN guidelines from the States, and look at the recommendations. The last guidelines were published 2 years ago, which recommended at a high level of evidence that exercise for fatigue is really important. Getting someone to exercise is really hard if you're really exhausted. So the other evidence also supports massage. And so actually helping people to massage and get a good night's sleep really improves fatigue. And then you're looking at acupuncture and the role of traditional Chinese medicine and acupuncture in helping to restore, in Chinese medicine they call it the qi or the energy, but in getting people back into homeostasis or balance. And acupuncture plays quite a key role in assisting people with management of fatigue. And there's a recent study from Memorial Sloan Kettering from one of my colleagues, Jun Mao, and others looking at acupuncture for sleep disturbances, which also impact obviously on fatigue, and saying what if that acupuncture is as effective as cognitive behavioural therapy to improve sleep. And so as you can see, there's a lot of evidence, and there's a lot of evolving evidence on managing specific symptoms using complementary therapies. And I can talk about yoga and mindfulness and exercise, obviously, and diet changes. And all of these have different levels of evidence depending on the symptoms and depending on the cancer type. Obviously, most of the research is done in the most common cancers, and that's not bladder cancer. Most of the research is done in women with breast cancer or people with colorectal cancer. And so we say, well, let's take that evidence and see how can we safely apply that to other cancer patients, and then evaluate those patients further. Yeah, so what I would add in there is when we're talking about the novel new treatments for bladder cancer, we're looking at immunotherapy, and we know that immunotherapy has a completely different set of side effects and toxicities. The most common toxicities are fatigue, joint pain. So a lot of people experience joint pain, and can get a lot of bowel disturbances. And so we look at where does integrative oncology play a role, and these complementary therapies play a role in supporting people who are receiving immunotherapy. An example is acupuncture for joint pain, exercise, obviously, to improve the fatigue, and yoga. So a lot of our patients are practicing yoga to keep mobile. People get very stiff from the joint pain and the arthralgias, the discomfort from either swollen or stiff joints. And so exercise like qigong, yoga, and a personalised exercise program are really a part of this whole approach to how we best support people with the specific toxicities from the treatment they're receiving. One side effect of treatment can be lymphedema, particularly lower limb lymphedema. And this has become a part of our department in our supportive care and integrative oncology department, is looking at what you can do for early assessment of lymphedema and then proactive management of lymphedema. So looking at bioimpedance machines that can pick up early lymphedema of the lower limb, which are now in development. So ideally seeing somebody, a lymphedema specialist or a lymphedema service, that can do a proactive assessment, assessing who's at risk of developing lymphedema, and then being taught self-massage, but also carers being taught how to massage, being fitted for garments if garments are needed, but also the role of exercise for managing lymphedema, which is a really growing field. And so looking at that holistic approach to managing lymphedema and early intervention. So for us, for example, we have an early intervention program, an early assessment, early education, and proactive massage and treatment to reduce the development of what can be a chronic and disabling condition. With joint pain, with fatigue, you think, I just want to sit on the couch and rest. And we used to think that rest was good, and now we know that we want people exercising. We're actually doing a study getting people to exercise while they're having treatment. So in the chemo suite, so we're really looking at how does exercise improve cancer outcomes. So don't stop, move. So bladder cancer isn't one disease, it's multiple diseases, and people have cancer at different stages. So some people may have very superficial disease and really struggle with the treatments related to BCG, for example. There are people who are having symptoms related to needing surgery, either through having stoma formation or neobladder formation, and with or without radiotherapy treatment. And treating the toxicity of that proactively is incredibly important. And then looking at people with metastatic disease, how they live well with metastatic disease. And so all of those patients have different needs, and it's personalising the approach and sitting with them and saying, how do we best empower you to take the most proactive approach, and what evidence-based therapies best assist you in reaching that goal of maintaining health and well-being independent of your prognosis. And then there's, with bladder cancer, we're also then looking at the safe use of selected herbs and supplements. And I often talk to people who are in that surveillance space, and they say, what else can I do? I'm doing everything, I'm exercising, I'm eating well, my bloods are all great, but I really want to do something else that may improve my chances of surviving longer. And so we look at where the evidence is with certain herbs and supplements that may be beneficial. There's a lot of interest in the microbiome and gut health, and the importance of maintaining a really diverse microbiome, either through diet with prebiotic and probiotic foods, analysis of your microbiome and adjusting your diet accordingly, or the use of probiotics. But those discussions are really important because gut health is really important. We often know that people who have had a lot of treatments may have quite a low diversity of their microbiome. People who may have had a lot of antibiotics through recurrent urinary tract infections may have a unhealthy microbiome, and increasingly we're looking at better responses to immunotherapy and better sense of well-being for people who have a more diverse microbiome. So that's a bit of a focus on how you can improve that with probiotics and diet. The other focus is the interesting space of Chinese medicinal mushrooms, and I'm not talking about psychedelics. So looking at things like shiitake and maitake and reishi and turkey tail and some of the Chinese mushrooms, which are immune modulators in Chinese medicine. And increasingly people are studying the role of these immune modulators in cancer. And so looking at, number one, are they safe? Do they interfere in any way? And this is with all herbs and supplements. Do they interfere in any way with other treatment that you're receiving, whether it's other medications you're taking or a chemotherapy or a targeted treatment, to make sure it doesn't make that treatment less effective or more toxic? But then does it have a potential benefit with minimal toxicity? And so weighing that up and looking at that space is some of the work that I do, and I find that very interesting. I think the key point then is safety, and I think this is a big space and it's a big industry. The pharmaceutical industry with regard to herbs and supplements is huge. If any of you have walked down the aisles of Chemist Warehouse, you'll know that you can take a different herb and a different supplement for various ailments. So that needs to be guided and it needs to be safe, and it needs to be done ideally through an integrative medicine general practitioner or someone like myself working in integrative oncology, or a very skilled naturopath that specialises in cancer, to make sure that you're taking the right supplements in the right dose and not self-medicating.